Medications can be tricky to keep straight, especially when you have multiple prescriptions.
As seniors get older, they tend to have more chronic conditions. They tend to be on more medications to treat those chronic conditions. And the more medications you have, you get polypharmacy, you get more risk of possible interactions or causing problems.
It isn't just prescribed medications, but food and alcohol can have an effect on medications you are taking. Alcohol is the most misused substance, followed by cannabis.
Diet plays an important role in every aspect of healthcare, and taking medications and interactions with foods, beverages, alcohol. Those things are no different.
The American Psychological Association says that 1 in 11 adults over 60 had a substance use disorder in 2022, with common risk factors of bereavement, forced retirement, and health problems.
So when you're looking at side effects of medicines, when you're looking at possible interactions, there's lots of different symptoms. So things like confusion, dizziness, drowsiness, unsteady walking, nausea, vomiting, upset stomach, changes in vital signs like blood pressures, either too high or too low.
Mercy Springfield says it's important to make sure you have conversations with your doctor when it comes to the medications you are taking and talk about concerns you may have.
There's always that risk anytime you're dealing with people. I think communication is key. Communication between the patients, the family members are an important part of the care team, and the physicians. And so it's important to educate the patients on how to take their medications, when to take their medications, and possible side effects of those medicines.